Explains how. I'm joined by Jeffrey Flaks, President and CEO of Hartford HealthCare. Thank you for being with us again.
Hey, Kara, thank you.
Pivotal time as the state prepares to reopen and get back to some sense of normal. You have a different approach as far as what this is going to look like, and I know you're even helping companies right now figure out what that's going to look like.
We are. We're working with the governor. We're working with the state. And more recently, we're now serving in a number of instances where we've put some of our physicians in as chief medical officers, working with large companies, helping guide them, helping them shape their policy, and helping them make good science-based decisions on how to restart their workforce and really bring them back to their physical environments. So I think it's an important step forward, and we're delighted to be working so closely with our corporate community.
What has to happen for people to feel safe? What should happen?
Well, first of all, testing is absolutely critical. Screening is important. So having the right provisions in place, the right mechanisms to ensure that there's access for all staff members returning to work. But in addition, our team is looking at the cleanliness of the environments, the hygienic aspects of the different environments, the structure of the physical environments. So our team is advising at all different levels around infection control, different procedures that should be put in place, and it's important to do. And I applaud these different companies for ensuring the safety of their organization and making sure the right things are done.
Do you think all workers need to be tested to go back?
You know, it's a debate, and right now we're all driving access. The Restart Connecticut Task Force is improving access to testing dramatically. We're doing so much testing today, well beyond what we've ever done before. We have 10 test centers set up throughout Connecticut. So for people who are symptomatic, absolutely testing needs to be in place. But today we're testing many more people who are asymptomatic, and we're testing people without any physician notes. There's no barriers to getting access to testing.
And what about bringing people back to the doctor? I know some people have been afraid and have delayed care.
You know, it's a really important issue, Karen. I'm so pleased that we've made great progress over the last week to 10 days. We're seeing in a number of our physician offices that we're putting plexiglass in place to protect exposure between our staff and the people who are coming to get care and services from us. We're using technology where people can wait in their cars and are getting texted on when they're ready and when they can enter the room. So we've eliminated interactions in that regard. We've restructured our furniture placements. We've put screening in place, temperature taking. Certainly before anybody gets surgeries in any of our surgery centers, they're getting tested, as are our staff. So there's been so many preparations put in place that are important to do. So we've made real progress in this space.
Thank you, Jeff Flaks, for that important information, and we'll see what it's going to look like next week.
Thank you, Kara.